Typically, we do classroom by classroom. So we're scheduled with the school on a certain day. We're usually there all day. We arrive, we start testing at 8 a.m. And the school and the administration bring students down, throughout the day. They're on a rotating schedule. They come, they get in line. Their first encounters with our logistician, who makes sure that they're in the proper line and that they're spaced and they're doing, all those safety precautions. The next person that they're going to meet in line is our data entry person. That person is going to collect their information to pull them up in the system to see if they're supposed to be testing, if they're supposed to do. So we do two different tests: the PRL, which is our nasal, but we also have a saliva. So some students are signed up that they need to do the saliva. So that data entry can collect all that information right when the student steps up. So after they're registered, their test is immediately registered at that point to them. There are two different ways it can go. For those older students, that test is put into a bag and the student holds the test and follows the line up to the tester. For those little ones, we usually have a logistician or somebody walk the test in between with the student so they're not touching it or doing anything like that. Also dependent on the age of the student and what's kind of going on with them, they might prefer to do their own nasal swab. In that case, they're going to step up. Our HCP, our healthcare provider, is going to give them instructions, introduce themselves, let them know we're doing a COVID test. This is what it looks like. It's going to be 15 seconds on each side. For those older kids, do you prefer to do it yourself? Yes. Okay, so please hand sanitize. We make sure they hand sanitize. They do the 20-second rub in order to be nice and clean. Our HCP will open up the test, hand them the swab. They'll do the 15 on each side. They'll take it back. They'll mix it and get it put into the containers to go off to summer bio. And then they're dismissed. For some of our younger ones, if you saw the age group about 5 years old, they're small. It's really important to get eye level with children. We're scary. We're dressed in things, our faces are covered, our shoes, we look like, little monsters. So it's really important to get down on their level and make that eye contact and really explain what's going on. So typically in that situation, you'll see the HCP sitting for that test and have the child stand off to the side, just to make that eye contact and make them feel more comfortable. Sometimes, they'll allow you to do it, and if they're an age and you see them doing this and you're not going to get a good sample that way, that's when you offer, okay, buddy, would you like to do it? Once again, little one's going to hand sanitize. You're going to watch them hold the swab and you'll count together. We have students with special needs or, special circumstances where we have to adjust our testing. Sometimes a parent will come in with them. And it says in the system you can't test the student without a parent present. So there are little safeties in that as well. So, if a parent, we won't restrain a child. But if a parent comes in and is testing and they want to hold their child for the test, they can do that. We do not do that. We are hands-off. So we don't ever touch any of the students. Once they're done, they're dismissed to go back to their class, and that's it. It's a very simple process.